Welcome, Nicole. Welcome, Shashi, and welcome, Nicole. And this is the second metabolic health conference that we are now sitting in, India's second. And let me introduce the guest for the evening. Nicole Loha is a licensed medical mental health counselor in the United States and a pioneering advocate for metabolic psychiatry. With over 15 years of clinical experience as a mental health counselor, she specializes in using ketogenic diets to treat mental illness. She's a recipient of the Metabolic Mind Award and contributes globally, serving on clinical advisory boards and instructing NBCC certified continuing education in metabolic psychiatry for non prescribing psychotherapists, aiming to enhance mental health professionals' knowledge in the US and Canada. Her published work focuses on bridging the gap between research science, clinical nutrition, and psychology practice. Welcome, Nicole. I'm Hira, your co-host with Shashi.
Hi, thank you. It's nice to be here.
Nicole will just start with asking a very simple question. I think what exactly are these mental health condition like bipolar, schizophrenia, depression, which seems to be very, very common, including the anxiety. Just in short, what exactly is bipolar or schizo mostly?
So there's that's a big question. We have a whole book called the DSM-5 that talks about what those are. So I don't know if I can
in 2-3 lines, very well.
Yes. So say they are disorders of the brain. So we're finding that there seems to be some very big contributors to schizophrenia and bipolar disorder that we perhaps overlooked or didn't have on the radar, that we're finding are actually quite amenable to treatment. And so, bipolar disorder is, there's different types. Some people experience more mania and hypomania. Some people experience more kind of treatment-resistant depression symptoms. And then schizophrenia or schizoaffective disorder and bipolar, there's different times when different pieces of psychosis can be experienced. And those are considered what we label generally as serious mental illness. Not that all the other people suffering with all the other diagnoses, it's not serious for them. But there's a full range of different psychiatric diagnoses.
Hey, Nicole, are these difficult to treat conditions? I mean, do patients really recover ever and get off medicines? And what is the issue with the current way they are being treated?
Right. So we've had treatments for bipolar and schizophrenia through medications primarily. And much of the therapy and psychotherapy that I've been taught has been about keeping people on those medications, regardless of the side effect issues. But for many people, those side effect issues are quite unbearable and their quality of life is quite low. And as we're understanding, and we've understood for quite a long time that these medications over long term, at the doses that they've been prescribed, can really cause a lot of havoc in metabolic health. And so there's ramifications to being on these medications, I think, in high doses over many decades. And so Chris Palmer has talked about it extensively, that not only is it a quality of life issue to be on high doses of these medications trying to function, but also their life expectancy is reduced. And it's not necessarily because of suicide, although that is a huge issue. For example, with bipolar, the suicide rate can be very high. And the problem is, but it's cardiovascular. It's these metabolic syndromes that cut life short for these populations. And so there's these pieces. So for some people, like for example, we're treating it with medication, and I'm not a prescriber, but I've been in the mental health field for a long time, and my understanding is that we do a pretty good job of controlling mania. We have decent medications for that. They do have side effects, But when it comes, and they do have side effects, and I don't say that minimally because the people that come to me, those side effects are devastating. So I'm not minimizing that. But when it comes to control for the depressive symptoms of bipolar disorder, our medications are insufficient. And that's kind of documented in the literature. So what's the problem with the way we're treating it now? It falls really short. Yeah.
So I think with the plethora of medication we have, I think it appears that we are still not able to get it adequately controlled or get it reversed. So of late, we have been hearing about this ketogenic diet in mental health. So do give us some picture, how is it useful in this condition? Does it really benefit in those with bipolar or schizo?
Yeah, so some of the most stunning and transformative cases I have had have been with bipolar disorder and schizophrenia. And that's not just in my therapy room. There's other practitioners using ketogenic diets for serious mental illness that are also reporting some of the same outcomes, or many of the same outcomes. So the way that we treat it, so I think we're paying attention to the fact that mitochondrial function and metabolism matter. And yeah, I just see really wonderful results using it. I'll self-disclose, I've been a mental health counselor for over 16 years now. And about the last 6 years, I've been using ketogenic diets as a treatment for mental illness. And I don't just use it for serious mental illness like bipolar and schizophrenia, schizoaffective disorder. I also use it for depression and anxiety and other things for sure, neurological issues. So, but about, before I began doing that, I was thinking of retiring as a mental health professional because you would see very minimal improvement for some people, or for many people. And so I was actually thinking of a career change and then moving with this and now using ketogenic metabolic therapy with my psychology tools, my psychotherapy tools has just really made me very excited for the next, 10 or 20 more years that I'm going to practice.
I think that's a very drastic change you had. Probably the whole ketogenic approach has changed the landscape of treating mental illness.
Mm-hmm. It has.
Yeah, Ira.
Nicole, does the low carb diet work, or does one need specifically to be on keto diet in such cases? And then what's your view on the carnivore diet then?
Yeah. So some people just go low carb, they don't track, and they get absolutely huge mood benefits, and they do really, really well. And some people make, right now, clinically, we're kind of looking at ketone levels and how different ketone levels can provide therapeutic effects. And there's been some research that has begun to talk about how ketone levels can correlate with improved mood and improved mood stabilization. And there's also been some discussion about, what else is it? Where they, adherence. So that the people who are adherent, the most adherent, that stick to it and don't falter, get recovery faster. So the Shabani Sethi's pilot trial kind of showed that people were either recovered or on their way to recovering, and the people who were less adherent were still on their way to recovering after about 4 months. But and that, that's the piece about ketogenic diet. So I hope I don't go too much off kilter. I just really want to share all this information. But I get a lot of people that come in and they kind of treat the ketogenic diet like they would a medication. And they kind of tell themselves, oh, I'm not getting complete symptom relief. This isn't working for me. And the ketogenic diet as a metabolic therapy, and I'll come back to your question about low carb, is you may get symptom reduction, that's like a side benefit, guys. That's a side benefit. The symptom reduction that you're likely potentially going to get on a ketogenic diet is a side benefit, but you're there to heal your brain. So when we use this for epilepsy, the average amount of time it takes for people to experience seizure control is 3.2 months. So that means it takes some people longer. It takes them 4 months, but some people can start having reductions in just a few weeks, right? Almost magically. So there's this continuum. And there's a lot of people who have psychiatric symptoms that try a low carb diet and they haven't gone to see someone to get their, they haven't started tracking, you know, they don't have that guidance yet to figure out how to get those ketone levels into potentially therapeutic ranges. They don't have someone helping them make the lifestyle and behavioral changes they need for adherence, right? And they do it for a couple months and they're like, maybe I feel better, maybe I don't. I'm going to go back to what I usually do. And they really haven't given it a fair shake, particularly if they are looking at it through the lens like this is supposed to work like a medication and my symptoms are supposed to go away immediately. When people use it for epilepsy, they still have seizures for those first few months. But over time, what they see is that the frequency and the intensity of the seizures get better and better and better until seizure control occurs. I see that it looks just like that when you use ketogenic diets for mental health. Most of my work, and as you guys train professionals to help people with this over there, I will say most of your work is going to be helping people understand that this is not like a medication with symptom control, that this is healing their brain. Like we have to give this time to see if this is going to heal your brain and if this is going to be life-changing for you and if this is going to make you feel better. So really a lot of it is psychology and psychotherapists, psychologists. I'm not sure what you call yours over there. Probably psychologists, yes. Therapists, yes. Counselors, yes. They have a very important role to play in this, in giving the emotional support and helping people manage expectations appropriately so that they can do this long enough to give this a fair shot and change their mindset about what this is supposed to look like. So yeah, I think I answered your question.
Yes.
Oh, carnivore.
Right.
Carnivore.
Yeah.
Yeah. Sometimes I'll pull out carnivore if they're not getting a good, you know, a good response to a ketogenic diet. And I think there might be some other kind of dietary difficulty going on with plant foods, but I'm not averse to carnivore. And you can do carnivore from a very high fat standpoint and get ketones up just fine.
Fine. So the general perception in India, and probably there also, that ketogenic diet, the word itself appears to be a very dangerous diet. So now down here, we think that it's a very dangerous diet. Your kidney is going to get damaged. You'll have heart attack. You'll have brain stroke. All kind of misconceptions are here. So do you face the same thing there when you mention ketogenic diet for mental health?
You know, it's hard because the people I hang out with or the people who seek me out are clearly open to it because they're looking at it for a treatment. And I get to hang out with all the great researchers and the clinicians who know that it's absolutely not dangerous in any way. So that's I don't know. I'd have to get out of my bubble a little bit more to kind of, talk to people on the street and see what they think. I think over here, they believe that it's mostly a weight loss diet. I think over here, there's lots of people who think all that fat is super bad for you. And you're, great, you could do the keto diet, but you're going to die of heart disease later, right? So I think that's kind of the general idea, but that's just, really too bad that they believe that. And that is obviously not what the science says. So because I get to hang out with a lot of really smart researchers, they, and neuroscientists, and they tell me that ketones, the production of ketones appear to stabilize the brain. And they tell me that as we age, our ability to use glucose efficiently in the brain goes down and neural network stability goes down. And ketones have a stabilizing effect on neural networks, and they also appear to have stabilizing effects in other organ systems, which I'm sure all of your speakers have spoken about over the last couple of days. So, and so there's always the question, is it the ketones? Is it the improvement in the mitochondrial functioning that ketones provide? But we do know that there's some combination of pleiotropic effects. Pleiotropic just simply meaning that there's beneficial effects to several different systems working together. And some researchers are beginning to suggest that chronic disease is driven because of a lack of periods of ketosis for stabilization. So those people listening that are afraid of ketones, I want you to understand that if your fasting insulin is not too high, if you don't have too much hyperinsulinemia, then after dinner and you begin to fast, you start to make ketones, and your brain really looks forward to that time. So while you're afraid of it, your brain is quite anxious for you to have some ketones.
Yeah.
And I think just to add to it has been proven, just a minute, it has been proven at least in epilepsy cases where it has been ketogenic diet has been recommended in intractable cases in kids. We don't hear that ketones kills them or ketogenic diet kills them. They don't face kidney disease or heart disease. They grow up to be healthy kids. So I think somewhere people have to realize that this is not dangerous. In fact, the newer drugs in diabetes like SGLT2 inhibitors actually releases ketones, which are said to be superfuels for a lot of end organs. One of the mode of action is on ketones. So I think somewhere the public perception has to change. I think it's a good point you made. Thank you. Yeah, over to Ira.
Yeah. Nicole, how did you come across keto for mental health? And have you had a personal story with any kind of struggles with mental issues or something like that?
Oh my goodness. I don't think I know anyone on the planet who hasn't had a time in their life where they weren't feeling particularly stable with their mental health. So I found a ketogenic diet because I had cognitive impairment, and it was quite bad. I did not have Alzheimer's, but I did have the impairment that you see in stage 1 Alzheimer's. My brain was not working. I thought I wasn't going to be able to practice anymore. I started to just really struggle. And because of people like you who, host people to talk, in the States, there's a podcast called STEM Talk. And I happened to hear Dom D'Agostino talk on STEM Talk about ketogenic diets, and he had mentioned Alzheimer's. And I thought, oh, maybe that will help me. And after a few months of fumbling to get it right, it worked. My brain lit up, which is what you kind of, in a good way, which is what you kind of hear people say who are quick responders to it. And the thing that I noticed most profound, one of the things that was most profound was my mood shifted. Like, I am a therapist and I have many psychotherapy skills, and I am very good at emotion regulation. And I was using those tools all the time, unconsciously. They were second nature to me. But I did not realize how often and how much I needed to use them, and that I was walking around in a state of almost constant and chronic overwhelm. And I was using my psychotherapy tools to manage that. But when I went on a ketogenic diet, that overwhelm just melted away. And I noticed I wasn't even reaching for those tools. I wasn't even needing those tools. And I thought, oh my goodness, my patients, my clients need to have access to this. This is important. And so then I went and got trained with Georgia Eid, and I saw all kinds of doctors and nurse practitioners and prescribers and other health professionals learning about it and deciding they were going to do it. And I was like, yep, this is the next stage of my career. I'm gonna bring this to people.
Yeah, Ira.
Nicole, first of all, thank you for sharing that bit, from your life. Really grateful. Tell us some success stories that you've had with KMH.
Yeah. So I'm in the process of working to publish a case report on the use of the ketogenic diet with treatment-resistant bipolar. So this individual was treatment resistant since adolescent, and when I met her, she was using a treatment. I don't know if it's available over there, but it is here. It's called ketamine infusions or ketamine treatments, in order to get just like 1 or 2 days of relief a week, and then those depressive symptoms, very crushing and debilitating, would just come back. And she did the ketogenic diet and started to respond. And she just stopped going to her ketamine treatments, and she's doing wonderfully. And that's been life-changing for her. Like, everything opens up for people when they get this stuff actually treated in an effective manner. I also have worked with a 17-year-old with schizoaffective disorder who was quite severe and highly suicidal. She came to me with her parents right out of hospitalization and decided she wanted to try this treatment, and she's in remission. Cold, hard, unbelievable remission. And she's going to be going to college this year. And there was no way her parents could safely send her to college. And her parents and siblings are just over the moon and happy and relieved that she's doing well. And she's in the process of very slowly and carefully titrating off her medications with her prescriber. And yeah, she's just doing really great. I can't wait to kind of write that one up, because I'm going to do a quantitative and a qualitative kind of assessment of the event, of the experience of the family having someone going through KMT. Yeah.
So can we say that now ketogenic diet for mental health is evidence-based according to how mainstream things, in the sense, is it recommended by the mental health associations or the psychiatric associations, or is it still at the infancy stage and very select people are using it?
So it's not standard of care yet, but I truly believe right down to my toes that is inevitable, that it will become an evidence-based treatment that is offered to people in the very beginning as a potential option. So I believe that will eventually happen, because the families desperately want this and need this. So is it evidence-based? I think so. So we understand, this has been studied for a really long time in epilepsy, and we understand many of the underlying mechanisms that by which it's great for brains. I don't think there's any intervention that we have that has the effects that ketogenic diets have on brain health. We do not have a pill that does what this metabolic treatment does. So I think there's lots of good evidence, excellent evidence coming out of neuroscience about ketogenic diets. That sounds like an evidence-based to me, doesn't it, to you guys? And I think that there's also, we've got some clinical studies. We've got some clinical studies showing that people with serious mental illness can adhere to this diet and can manage it and can do it and can benefit from it. We've had the pilot trials, right? So and we have a pilot trial in bipolar, and we have another pilot trial that just came out from Stanford that is bipolar and schizophrenia. And I just did a tweet about this. And at the time I did the tweet, there was 10 RCTs because Shabani's study hadn't dropped yet. But there are 9 randomized controlled trials going on right now all over the world looking at this. And people just don't fund randomized controlled trials unless the studies are really, really good. The evidence base under them is significant enough. Now, this is kind of a sore point for me, because I think that those who rely only on randomized controlled trials to make treatment decisions, I think I'm going to be provocative here. I'm going to say, I think they need to examine their ethics around withholding care when we do have something with a nice, strong evidence base that is just not an RCT. because people are suffering terribly and even dying, right? So to completely disregard the existing evidence base that is there and ignore what we already know before offering this treatment, I think that is super disrespectful to the patients and the families who are suffering. But that's just kind of how I feel about it. So is it evidence-based? In my opinion, absolutely.
I know general perception
Nicole,
is yeah. So
hmm,
evidence-based means it has to come from somewhere. The association has to approve. There has to be a lot of studies, and of course, as you just mentioned, there are quite a lot of RCTs, and the recent Stanford study is also making quite a big impact. And I think as we have more of the studies coming in, it's going to certainly make a big impact. And we look for better treatment options other than the drugs available. Yeah, Ira.
hmm. So I just wanted to ask, Nicole, what is the role of a counselor in this?
Yeah, so yeah, I have a training that I offer that I feel really strongly about. So I'm a little bit different because I'm not just a counselor. I also help initiate and monitor the diet. So I have advanced training to do that. But for someone who is not trained in that way and just seeing patients and clients, so first of all, their biggest role is to become educated about it as a treatment and to understand what the research literature is. That is part of professional ethics over here, and I'm quite sure it's the case over there. Our information that we give patients is supposed to be based on the evidence, not on our opinion that is not based on the evidence. And so the very first thing how they help is they learn what the research literature is. And that's very important because we all have our odd little biases and preferences and thoughts and ideas about nutrition and so on and so forth. And if a counselor does not carefully educate themselves about what the research literature is about this diet, they could very much detour someone from the use of a ketogenic diet for whom this could save their life or their quality of life. And that would not be good. That would not be okay. So any counselors that are out there saying this is going to give you an eating disorder, you mustn't restrict in any way, shape, or form, you're going to die of a heart attack. Any counselor that's giving that kind of advice is not basing their practice in evidence-based psychology practice, professional roles. And so first is that education piece. And then the other piece is understanding that all of your beautiful, well-honed psychotherapy tools that you have mastered over the years or in the process of mastering, oh my goodness, those are just gold. Those are gold for those patients who are trying to implement this diet, who are trying to make all of these different changes to their lifestyle, to their eating. It affects their social events. It can affect marriages, right? One person changes, not all marriages are up for that. So it's just really important, and their patients, their clients deserve and benefit from your practice and your help of them during that piece. So we're supposed to be informed about treatments. We're considered experts, right? People go to us in the community, sometimes before a psychiatrist or a doctor for medication. We have got to give them accurate information. So that is their role. Their role is to just do what they fabulously already do and support people who are trying to feel better and who absolutely have the right to pursue this treatment should they think it's a good fit for them.
Yes.
Do you use any other components like, let us say, cognitive behavior therapy or something? What, or other than the dietary perspective counseling, any other tools you think will be useful? Do you use in your practice?
Yeah, so in the States, we have a license, and we're only allowed to practice psychotherapy in that state. And so I do have people in Washington State who I do practice psychotherapy with, and I do use a variety of tools such as CBT, dialectical behavior therapy, EMDR, behavior therapy. So those are kind of my go-to. I use a lot of something called narrative therapy as well. For my clients that I see outside of Washington State, you know, you can't really extract how you work, but many of those tools I use in a different setting, and we call it life coaching, right? In order to get people where they want to be. So I'm exclusively using my psychotherapy tools at this point to help people adopt and become successful on a ketogenic diet as a treatment for mental health. And then there's often processing that has to happen after that, because it's just part of treatment, right? Imagine you have serious mental illness, all the doors are closed to you, all the things you thought you were going to do or were gone, and sometimes for decades, right? Sometimes for decades. And then you have this treatment and your brain is healing, and you are suddenly able and capable of things that you didn't even think were possible. Like, you don't even know who you are anymore, right? Because suddenly you're doing all kinds of things that you before would have been overwhelming, or you would have been too cognitively impaired because of the side effects of medications to do. And so sometimes I will support people through that processing of like, what now? What do I want my life to look like? And sometimes I support people when, you know, they got a partial effect, but not a full effect. And they still want, you know, support figuring things out and still staying on their wellness path. So, but I do use ketogenic diets first, because quite frankly, it's a lot easier to progress in therapy when you have even a slightly better functioning brain. It really is.
What are the causes of these mental illnesses, Nicole? And do you think modern environmental issues could be one of the trigger factors for these?
Yeah, so that's another really kind of big question, right? Where we've got big books trying to figure out the etiologies and to what percentage the different factors play a role and weigh in. So let's see. So yes, so I am of the belief that nutrition should have always been the first line treatment for any kind of mental health issue. And I think that our modern diets, with a lack of nutrients, nutrient depleting pieces to it, high carbohydrate, poor protein consumption, all of these different factors contribute to psychiatric symptoms. You know, but that's just my one lens. If you talk to someone else, it's less about that and more about the conditions in which they live and their relationships and stressors. And then if you talk to someone else, you'll get a different lens. So and I think all of us are correct. I think all of us, there's pieces to all of these. These etiologies are very complex, but I think that when we give our brain the basic building blocks of what it needs to function, I think that our resiliency goes up. And I really do believe that it reduces the likelihood of the development of some of these symptoms. And so that's my little 2 cents in there.
One pertinent question I want to ask is, does every patient of bipolar, do they all respond to ketogenic diet, or you have experienced some who are intractable, they don't respond even to ketogenic?
Yeah, so there are non-responders, and we are still trying to figure out what phenotypes or that respond well, right? Or that are most likely to respond. I have not had too many non-responders in my practice, but that is just because I have a very small practice and I keep it that way. I know some of the studies have had non-responders. Studies are very short-lived though. And again, going back to what I said, I think there's a lot of confounding variables when we are deciding who is a non-responder. So I'm sure they exist, don't get me wrong, but some things that I think about is, okay, what medications were they on? Was there any confounding variables there that got in the way of their ability to feel the effects of the ketogenic diet, of the treatment? Was it for a very short period of time? Some of these studies are like 6 weeks, 8 weeks, and it takes 2 to 3 weeks to ramp them up to a ketogenic diet and get their ketone levels right? That's not even the 3.2 months necessarily that you need for seizure control. So what is this definition of non-responder? So I think the research has to kind of fine tune that and figure that out. I don't know if some of these people would do better on a longer amount of time. And I don't know if there's certain diagnoses that will respond better than others. But the way I think about it is, we don't have great treatments. And this is, once you kind of get the hang of this is not a terrible way to eat, right? There's a lot of people who have a lot of pleasure eating in a ketogenic way. And I think that instead of focusing so much on the fact that there may be non-responders, I think it's a great focus to think about, we don't know the answer to that yet completely. Mm-hmm. And that this is providing a level of treatment that I think is beyond what a medication can offer.
Yeah, I think that I do have one case where he's not responding. That case also sometimes he's been tweeting. So that we have been trying everything. Mm-hmm. So is it possible that some of these intractable cases, will they require some bridge medication, or why they are not being? I mean, it is just putting a thought.
Yeah. So yes. So there are people who are not responding well. And when that's the case, so I also have training in functional nutrition, and I'm also part of a functional psychiatry fellowship as a non-prescriber, learning about different things to test for, to kind of try to rule out other potential root causes that might be underlying, a non-responsive case. And I think that there's likely, I think there's going to be non-responders because I think sometimes it wasn't completely a metabolic issue for that person. There's all kinds of different, there's exposure to, toxicity that can disrupt enzyme production, which can disrupt mitochondrial function. There's people who have had exposure to heavy metals and or have a chronic heavy metal load that also will disrupt things. So if someone doesn't respond as well to a ketogenic diet as we were hoping, then if they're working with me or they're working with a different practitioner, sometimes that's just data, and we just keep going. We just keep going until we figure out to the best of our ability what's going on.
So you mean that there could be some other issue like heavy metals also, possibly?
Yeah, there can, there's, so in functional medicine, and I'm not a functional medical practitioner, I'm a functional nutritionist, but, I will send people off to a functional medicine person to evaluate for things like mold exposure, heavy metals. There's all kinds of different things. There's, over here in the States, there's tick infection. So people can have that sort of thing. And all of those things I just mentioned can manifest themselves as psychiatric symptoms. So, so there's not just keto, there's lots of different ways to go at things from a root, what's hoped to be a root cause foundation. But, I think, and I don't do those types of functional tests on people unless they're on a ketogenic diet, because I think that primarily the improvement you get in mitochondrial function with a ketogenic diet will clean up the testing environment in such a way that you're much more likely to be able to figure out what's going on. Metabolism is huge. So, a ketogenic diet is a big piece, but there's nutritional stuff too. Like if you're doing keto, a ketogenic diet and your protein consumption is poor, like you're not getting very much protein, you need protein to make amino acids, to make your neurotransmitters. If your vitamin D levels are on the floor, you need that. You need micronutrients to turn amino acids into your neurotransmitters. Again, if it is, nutrition has to be a foundational piece of our mental health treatment.
Yeah. Ira, you
I
want to
think
ask
we've
something?
almost.
Yeah.
I just a short question. I think we still have 2-3 minutes left. Nicole, how do you see the future of mental health treatment, and do you see keto getting more mainstream as far as this is concerned?
Yeah, I think that's inevitable that ketogenic diets as a treatment for mental illness will become more mainstream. And, I think that the pharmaceutical companies are going to push it? No. And is there a certain amount of concern that it won't make it into the medical curriculum? Yes, but I think that eventually that is absolutely going to happen. And in the meantime, as people watch other people recover, this treatment is going to be sought out. And if this treatment is sought out, then that is a profit motive for hospitals and medical centers. And if they've got people calling every day asking, hey, do you have this for me to try? Do you have this for me to try? And they don't have a program, I think that's going to motivate that. So I'm very hopeful. And I really think we need to keep our focus on what we want to see happen, and do a little something every day on our parts to make that happen, as opposed to put all of our energy into talking about and discussing all of the barriers, because that is just not a good use of our energy. Keep the eye on the prize, people. Keep the eye on the prize.
Thanks, Nicole. I think getting a viewpoint from a counselor was very important for us. You are a non-prescribing management team for the mental health, and such a view is always very, very valuable for us. And your past experience of not into keto and coming to ketogenic diet as one of the part of the therapy. So this really provides very important perspective for us, and it sets in a hope for India also, that though we don't have a single metabolic psychiatrist in India as of now, as far as I know, not a single one. And we hope that in future, we may have someone, but then such programs, you coming and talking in it gives hope for people of India, those suffering from intractable conditions, that there is a hope. Maybe not 100% will respond, but even if 75-80% will respond, it gives them a lot of relief, is what I see.
Yeah.
So thank you very much for coming in this program and sharing your knowledge. So we'll just have a word from Anup. Anup is the co-organizer, so both of us have been organizing. So just get in Anup in the spotlight.
Yeah, thank you, Nicole. Thank you for accepting the invite and coming and speaking to us. And as Shashi said, we do hope that after this session, maybe just one doctor understands what's going on and tries to implement in some way or the other ketogenic diet for mental disorders. So thanks a lot. Thanks once again.
Thank you, Nicole. Thank you.
Thank you.
Thank you for coming, Nicole.